My name is Merisa Piper. I will present a quantitative evaluation of the effects of radiation therapy on the postsurgical breast, written by Becker, Chris Reed, and their co-authors from the University of California, San Diego. This was a single-institution retrospective study examining volume changes of the breast in patients with T1 tumors who underwent breast-conserving treatment, meaning lumpectomy and radiotherapy. They included 113 patients and 115 breasts over an 18-year period. The goal of their study was to use mammography to calculate change in breast volume over time due to the effect of radiation. Every patient had a preoperative baseline mammogram and then yearly post-radiation. In order to isolate post-treatment volume changes from volume loss during surgery, the tumor defect volume was subtracted from the preoperative baseline volume to determine the post-operative baseline volume. Volume changes were then calculated relative to this baseline. They found that there was a mean volume decrease of 19.3% at 1 year following radiation. Additional volume change was observed yearly for 5 years. By the 5th year post-radiation, the total volume decrease was 26.6%. They found no difference between those breasts that received partial versus whole breast radiation. On regression analysis, they found greater preoperative breast volume, smoking history, diabetes, and cytotoxic chemotherapy were significant predictors of breast shrinkage. In conclusion, the authors found progressive volume loss over time in patients undergoing lumpectomy and radiation. Surprisingly, radiation dose was not a significant predictor of volume loss. This provides important information for those who work with patients undergoing BCT to provide appropriate preoperative counseling on the ongoing change in breast volume after radiation and risk factors for increased shrinkage. Additionally, this knowledge can be used in surgical planning and with intraoperative adjustments to improve symmetry and aesthetic outcomes, accounting for expected volume loss over time, as well as lay down expectations of how the final outcome will progressively evolve for at least 5 years after radiation therapy is complete.